Hi class, my name is Ashley Robinson. I'm here to do the head, neck, and face assessment. First things first, you're going to want to wash your hands for 20 seconds with warm soap and water. Next, I have my lovely patient here. I'm going to be, throughout this assessment, I'm going to explain what I'm doing to you. I'm going to be touching you, and you're also going to be helping me by completing small tasks throughout this assessment. So the first thing that we're going to do, we're going to start with the hair. We're going to look at the hair color, the texture, and the distribution. The color and texture is fine. Distribution is nice and even. Moving on to the scalp, parting the hair. We're going to see if there's any lesions or anything like that. Inspecting the cranium. We're going to look at the size, the shape, see if there's any tenderness. When I press on it, is there any tenderness? No. Okay, thank you. Next, we're going to move on to the eyebrows to see if they're nice and even, which they are. We're going to move on to the sides of the mouth. Those are also even. We're looking for symmetry here. See if everything is in alignment. The nose, the bridge of the nose, everything is in alignment. There's no swelling noted here, no lesions or anything like that. So we're moving on to cranial nerve number 7. Cranial nerve number 7 is a facial nerve. Now from here, how you test that is if you could please smile for me. Could you frown for me? Could you furrow your eyebrows for me? Okay, great. And next thing, puff up your cheeks. And then I'm gonna press on them. Okay, great. That's wonderful. Now that checks cranial nerve number 7. To check cranial nerve number 5, which is your trigeminal, I'm going to palpate in between here. And could you clench your teeth down for me, please? And relax. Okay, great. That assessed my chewing muscles, my mastication muscles, my masseter, my masseter muscles. So that assesses, my chewing. So next, after that, we're going to move on to your sinuses. I'm going to palpate for your sinuses. Okay, great. Thank you. The next, we're going to move on to the eyes. Again, they're symmetrical. You can open your eyes for me, please. Looking at her sclera, they're nice and white. Pupils are reactive to light. Follow my finger for me, please. Okay, great. Her irises are nice and brown. There's no redness in her conjunctiva. Everything's intact. No lesions or mucus or anything like that of the sorts. Moving on to the ears, we're going to see that they're nice and even, nice and clean. Any pain noted when I pull on them? No. Okay, great. So then we're going to move on to cranial nerve number 8, which is your auditory nerve. I'm going to whisper a series of words and you're going to repeat them for me, okay?
Basketball.
Okay, great. Coming on the other side.
Football.
Okay, great. Thank you. So we tested that. Next, we're going to move on to the nose. We're going to see again, this is nice and symmetrical. The nares are nice and symmetrical. The nose is midline. Could you tilt your head back for me, please? Seeing the nares are nice and patent and open and free of debris. You can relax your head. Can you test? We're going to test the patency of your nasal passages. Could you close one nair for me, please? And inhale and exhale. And the same for the other side. Okay, great, wonderful. Next thing, could you close your eyes for me, please? All right. Could you tell me what you smell?
Some sour pickles.
Pickles. Okay, great. Next, we're going to move on to the mouth. We're going to look at the lips, the color, see if they're nice and moisture. There's no cracks or lesions or anything like that. Looking at, could you open your mouth for me, please? Looking at her teeth, they're in a nice place and order. They're nice and white. Her gums, let's see, there's no sign of redness or swelling. Any pain noted at this time? No. Okay, stick your tongue out for me, please. Okay, right. And could you say ah? Ah. Okay, great. Now what I did there, and also, I'm sorry, say one more thing for me. You can close your mouth. Say one thing for me. Light, tight, dynamite.
Light, tight, dynamite.
Okay, great. That tested the hypoglossal nerve, which is cranial nerve number 2. Moving on, we're going to test your cranial nerve number 9 and 10. That's how we did by saying, say ah for me. Ah. Okay, and that tests your glossopharyngeal and vagus nerve, cranial nerve number 9 and 10. Also, inspecting the mouth. Could you open your mouth one more time? I'm looking at the tonsils and the palate. the soft palate. Everything is free of lesions, no redness or swelling noted at this time. And then I don't know if we moved on to the neck, but we're gonna check the symmetry there. Hold your neck up for me. There we go. We're looking at the symmetry. No lumps or swelling noted at this time. Her trachea is midline, as you can tell. And then checking for her thyroid. There's it's intact. No pain noted at this time. Okay. And then one thing that I did miss over that we need to go over are the lymph nodes, the 10 lymph nodes. Now the 10 lymph nodes are the posterior auricular, the occipital, and the pre-auricular, the jugulogastric, posterior and superficial cervical, well the posterior cervical and superficial cervical, the supraclavicular, the submandibular, and the submental, and the deep cervical. Those are your lymph nodes located throughout your face, and this has been the head, neck, and face assessment. Thank you.